Hello, good evening. Welcome to our Bringing Birmingham to You event on a national care service. We're really delighted to have you here this evening. I'm Catherine Needham. I'm Professor of Public Policy and Public Management here at the University of Birmingham, with a particular focus on adult social care. And I'm leading our new membership of the Economic and Social Research Council Centre for Care, which we're all really excited about. Before we get started on the discussion, just a few points of Zoom etiquette. The webinar is being recorded. It will go up on YouTube afterwards, so people who haven't been able to make it tonight can have access to it. Only the speakers will be captured on the recording. Yes, that's not something to consider, but do remember, if you're putting things in the chat, that it will be that will be captured and that will be part of the YouTube recording. You can put comments in the chat throughout, and you can also ask questions via the Q&A box, which you'll see at the bottom. And then when we get to the Q&A part of today, we'll pick up some questions from there, depending on the time we've got. But we do want to hear from you and get your perspectives on some of the issues that we're going to be talking about. Bringing Birmingham to You is an event series from the university's alumni office, which is about connecting Birmingham academics to the global alumni community. And obviously Zoom creates fantastic opportunities to bring people in from all over the world, and people who wouldn't perhaps be able to come to these events face to face. You don't need any prior knowledge of the subject. I'm sure lots of the things we're talking about will resonate with you tonight, but it's not kind of an expert seminar series. We're really here to talk to you about some of the key issues around social care, and how that links to some of the research that we've been doing here at Birmingham and with our partners. So just a bit of context setting before I ask the panel to introduce themselves. We do a lot of social care research here at the university, and we're really keen that that research is intellectually rigorous, but also relevant to the kinds of policy questions that we're facing. Social care is a term which is used to encompass the support that's given to people with disabilities and older people around support with activities of daily living, but really is a way of helping people to live the kinds of lives they want to lead. It's not health, but the boundaries with health are blurred, and that's, I think, one of the things we'll get onto in the discussion. Unlike the NHS, social care is means tested, and it's delivered by local authorities rather than by the central government. So it currently operates quite differently from the NHS. And I think, and you'll probably be aware, that there's been quite a lot of widespread feeling, exacerbated by COVID, that social care is not working very well. There's very tight eligibility criteria. It's hard to get access to care. There's a huge amount of unmet need of people who aren't getting the support that they ought to be getting. Workforce shortages are severe and getting worse. And when you do access social care, it's often quite narrowly focused on really functional tasks, not about letting people have the kinds of lives that they want to lead and really thrive. Demographic challenges mean that these issues are getting worse. And so the discussion tonight is really in that context of a sense that what we've currently got isn't fit for purpose, and we need something different. And one of the things which has come forward from a number of political parties and is currently being pursued by the governments in Scotland and Wales is the idea of a national care service. So something like an NHS for care, and exactly how that would work will be one of the things we'll get into in the discussion. But the idea that on the whole, people like the NHS have a kind of strong affinity to it is one of the solutions to the social care problems, to move in that direction for social care. So we're going to hear first from the panels, a brief introduction from the panel. Anna, I'm going to come to you first, and just to say that we're really grateful to Anna for joining us. Anna's not been well, and will just give us a kind of 5-minute overview, I guess, of some of her thoughts. But we're delighted that her colleague Martin Routledge will be here kind of for the duration of the event. But just in terms of brief introductions, Anna, if I can come to you, and then Jon, and then Patrick and Martin.
Hi, I'm Anna Severwright. I live just down the road in Leicester. I'm one of the conveners of a movement called Social Care Future, and I'm somebody myself that draws on social care.
Thanks, Anna. Jon?
Hi everybody, my name's Jon Glasby. I'm a social worker by background and now a Professor of Health and Social Care at the University of Birmingham. And I'm also the UK Director of a new centre called Impact, which stands for Improving Adult Care Together and is the new UK Centre for implementing evidence in adult social care.
Thanks, John. Patrick?
Hi everyone, my name is Patrick Hall. I'm a PhD researcher here at the Health Services Management Centre. I've been working recently with Catherine, our chair, on some work comparing the UK's 4 social care systems and preparing some publications from that, hopefully culminating in a book next year. And yeah, currently undertaking a PhD exploring commissioning and the evaluation and inspection of commissioning of adult social care in England. And I'm also an associate at Social Care Institute for Excellence, but I'm really excited to be here.
Thanks, Patrick. Martin?
Hi, I'm also a social worker by background. I worked for about 20 years in and around local government and about 15 years in and around central government, in particular the social care part of the Department of Health for about 10 years. I'm also one of the conveners alongside Anna of Social Care Future, which is a voluntary-led movement with people who draw on social care at its heart, and including as well allies who work in or are linked to social care. We have a vision for very different social care, and our mission is to work with others to achieve that over time.
Thanks, Martin. So Anna, I'm going to come to you first then to give us your thoughts on, do we need a national care service?
Thank you, Catherine, for having me and giving me a few minutes just to talk about sort of my views as somebody that uses social care. Would I want a national care service? As Catherine said, I wasn't well at the weekend, and actually I got to experience some of the really good stuff that the NHS can do when you're very unwell. You know, you're sort of rushed into A&E, a bit like the scene from Casualty, and everyone's got their roles and they keep you alive, and it's all very, you know, I'm very grateful for that. But I think also with the NHS, often with long-term conditions, they're not quite so good at dealing with those and seeing the whole person and not just you as a list of conditions. So when we talk about a national care service, I think a lot of people think that that will mean that it will be seen, social care will be seen as important as the NHS. But I fear that actually it would get swallowed up by the NHS because social care is a lot smaller, but also that we could end up with quite a medical model for social care. So actually for me, social care should be about people's lives. It's not just about keeping me washed, fed and dressed. Actually, it should be about me being able to go to work. It should be about me being able to have a social life. It should be about me being able to travel or do the things that matter to me. So some of the reasons why I would be concerned, I guess, or not convinced that a national care service would fix social care. Some people say, well, if we have one big national care service that's sort of integrated and things, you might not have to repeat your story lots of times. So I think within 24 hours of arriving in hospital last week, I had told my story 8 times, and that was within 2 different departments of the same hospital. So I have absolutely no confidence that just creating another big structure is going to reduce how many times you tell your story. I think there's other factors that need to be addressed for that. Then people say, well, we need to professionalise the workforce because actually, you know, I think people that work in social care are amazing and I think they deserve a really good rate of pay. But I'm not convinced that professionalising them or putting them on a register will necessarily create better quality work. And actually, the one thing that did go a bit wrong while I was in hospital was that a doctor tried to put a cannula in me that wasn't for me. It was for a different patient because he hadn't checked my name or my date of birth. And he's on a register. He's a registered professional. So actually, I think there's a false dichotomy sometimes that people think, well, if we have people on a register, it will give carers more of status and more people want to do the job. My personal assistants that I employ are fantastic, but they're not on any register. They've often not even done a carer's job before, but they have the right attitude. And I think attitude is more important sometimes than regulations and being on some sort of register. And actually, I think it's more about the culture that we want to see in social care. And I'm not convinced that a big system can actually create that kind of culture. For me, it's about how we can have trust, how we can trust people and families that they are experts in their own lives, and also the workforce, that actually let them be creative and try and find solutions to people's lives that work well for those people. I think we need to be decreasing the bureaucracy in social care, not increasing it. And as someone who used to work in the NHS, I can tell you, it is full of bureaucracy and the amount of paperwork and forms and hierarchies. And actually, I think social care is about individual relationships. It's not about big structures. And for me, finally, really, it's about power. So at the moment, it feels like a lot of this is about central government wanting power or local government wanting power. And actually, I don't think either of those should be the places with most of the power. I think the power should go to individuals and communities and people's lives to say what they need in their life, how they could create that support, and then to be assisted to do that. And I think that comes through things like co-production, which is where you actually work with the people who are affected by the service to develop services, to improve things, because otherwise all that will happen is we will do a load of reshuffling, we'll create a national care service, so it will cost a lot of money, and people like me won't have any better lives, or people in later life won't have better experiences. And finally, I hear people say, well, we need a national care service so that everybody gets the same provision, so it's fair. But actually, I don't think everybody should get the same provision. I have a friend who needs 2 PAs 24/7 because they're on a ventilator and that's what they need. And that's fine. They should have all those more hours than me because I don't need that myself. But what we should have equity of is the same outcome. And that outcome should be that people are able to live the lives they want to live, whether in working age or in later life, that they can continue the things that matter to them. And at Social Care Future, we have a vision that is this: we all want to live in the place we call home, with the people and things that we love, in communities where we look out for one another, doing the things that matter to us. So for me, fundamentally, I would only want a national care service if somehow it was going to magically mean that we could all experience that vision in our lives. And for all the reasons I've just listed, I'm not convinced it would. So that's all from me. And thank you.
Thanks, Anna. We really appreciate you joining us and giving us that perspective, and particularly with all that experiences so fresh in your mind from your weekend's experience. So yeah, thank you very much for that. So we've got then Anna's perspective, and Anna, I know you need to go, so thank you, on kind of some of the kind of things to think about in relation to a national care service. So Jon, I'm going to come to you first around this sort of question of is a national care service in the style of the NHS something that we should be pushing for?
Well, in one sense, Catherine, I really agree with Anna. I asked my kids before I came on today, I'm doing this event, should we have a national care service? And my daughter said, well, it depends what you mean by a national care service. Do you mean that everything should be nationalised as opposed to privatised? Or do you mean it should be national rather than decentralised? And straight away, she hit on the power, but also the difficulties of slogans. I got involved in these debates back in the late 2000s, actually, when we were doing a lot of work at the university with Downing Street and with the Department of Health on their reforms of adult social care, quite late on in the life of the then new Labour government. And the kind of slogan of the National Care Service was part of those reforms. And like a lot of slogans, it sounds quite attractive when you first hear it, and you can imagine different people from different backgrounds aligning behind it. But of course, once you scratch beneath the surface of the soundbite, what does it actually mean? And you can end up with a situation where everyone ends up disappointed because they wanted it to achieve something slightly different. So we could be talking about a national care service that is a single monolithic set of services, maybe integrated into or even led by a clinically dominated NHS. We could mean nationalising the current set of services that are provided, the vast majority of which are currently provided in the private sector, not by the public sector at all. We could mean, as Anna was saying, standardised services with no local discretion, or perhaps more positively, we could mean a national funding settlement so that we have a greater debate about the kind of care that we want and the amount of money that we're prepared to make available as a society to try and achieve that. We could mean that we want more responsibility from national politicians around the quality of outcomes that we can all achieve through social care. We might want something that's funded free at the point of delivery from national taxation in the same way that the NHS is, and funding social care from local taxes and charges has always seemed a terrible way of funding care and support services to me. We might want something where there's a greater sense of entitlement, not about the nature of the services provided, as Anna was saying, but about the outcomes that we're trying to achieve and about the kind of eligibility for support. And we might want a bit more of a national infrastructure around some of the things that are done better at different kind of levels. And we could debate what those were, but should there be more of a national overview of workforce or leadership development about IT and use of new technology, about some of the terms and conditions that are available to social care workers, maybe even around some specialist commissioning services for particular groups of people that might have very complex and very, very expensive needs and so on. So I could see all kinds of benefits to a greater sense of national entitlement, but not with that single set of monolithic services, either alongside or integrated into a medically dominated NHS in the way that, you know, Anna was expressing concerns. So is a national care service a good idea? Well, yes or no, depending on what you mean by a national care service.
Thanks, John. And I think, yeah, I can see in the chat some kind of reflections on this. The sort of what's in and out of scope is really kind of unclear, in the sense that the term national care service is used in a few different sorts of ways. And although I think we could, if we sort of say, well, we're talking about social care here, so we're not talking about healthcare, even then there's still all sorts of questions of the kind that John's been alluding to. Patrick, I can see you nodding at that. Do you want to come in on this question of kind of, you know, what are some of the kind of definitional issues around a national care service?
Yeah, I wanted to kind of just maybe make the discussion a little bit more concrete around some of the proposals that are actually out there in Scotland at the moment. So the Scottish Government's proposals for a national care service really make us focus on that idea of a national care service as a kind of political framing in some ways, as opposed to a kind of, you know, as opposed to the kind of radical transformation which making it like the NHS might consist of. So there are proposals to increase funding, but by 25%, but it's unclear by which mechanism they might do that. Of course, you know, the Scottish Government is funded through the Barnett formula, by which the three devolved administrations are funded, and Scotland generally does quite well, or is considered to do quite well out of that process. But it's not clear how they would raise the additional funding to do something like nationalising the services that are already provided by the independent sector and the third sector. They talk about a lot of the time about facilitating this move towards prevention and early intervention throughout the proposals. But again, it's not necessarily clear how kind of centralising control over social care services would achieve that, you know, as opposed to the kind of current mechanisms of governance within adult social care, particularly the centrality of local government and its role in organising and commissioning and actually providing lots of services in Scotland. But the big change would be, for me in the Scottish proposals, the establishment of a kind of a central government layer of bureaucracy which is accountable directly to the Scottish Government, and almost the replacement of local government as that central agent with an integrated with a set of integrated boards, which, I mean, it's not clear actually in the consultation, you know, how this would work, but that they would replace local government as the central agent of delivery and the central responsible party. So, you know, I think if the question is, Do we want something like this in England? Then, you know, we have to think about, you know, what do we value about the role of local government in the mechanisms of delivering adult social care, of commissioning it, of understanding their local communities, of developing communities in which people look after each other. You know, do we think that removing that responsibility from local government will provide any of those things that we've talked about as the goals of the adult social care system? That's what I'd ask. It's another question, it's not an answer. But...
Thanks, Patrick. Martin, I'll come to you next. So is there, of the various kind of iterations or versions of a national care service that Jon's talked us through and that Patrick's talked about in relation to Scotland, are there any there that you think would be a kind of step forward? Are any of these what social care sector needs?
Just one thought that was going through my head listening to colleagues was what seems to be happening in Scotland is quite instructive, I think, because it started off with the work led by Derek Feely, where he brought lots of people together essentially to ask the question, what should social care do? And wrote what I thought was a really good report. And when that went into government, they've immediately jumped from function to form. And it strikes me that happens for a number of political reasons, essentially. So that the forces in play politically drive attention to form rather than function. Whereas we really need to pay much more attention to function. And the reason this happens is because, one of the reasons this happens is because the people like Anna are directly impacted by social care are effectively systematically excluded from the discussions about what it should be and how it should do those things. So the debates take place between system leaders, think tanks, political parties, academics, some good ones here, of course, they really systematically exclude people with lived experience. Anna herself modestly didn't say that last year she tried to model something very different. She coordinated inquiry led by 12 diverse people with direct experience of social care, asking the questions about how you want it to be. And the results from that were extremely different from the ones you get from typical government or think tank led inquiries. They were about what it should be trying to achieve, and then exploring some of the ways in which that might happen. So listening to Jon's kind of versions of a national care service, what might that mean? Well, if it means bureaucratic, monolithic, standardized services decided by managers and workers, delivered from a limited menu via time and task models with little choice and control for people, well, no thanks. No people in our movement don't want that. If it means tax funded, free to people that use it, I think many of us would be up for that. If it means people everywhere can expect adequate resources made available to them and their communities to locally organize how to help people to live lives that are the same as other people's, whatever age and stage of life that we're in, ones that are about living life, not just being kept alive, whatever age and stage of life we're at, then we'd be up for something like that. But it really does need to start from function, not form, and it doesn't do that. And I think in Scotland it's a classic. It started with people thinking about how this should be, and then as soon as it went into political arena, political forces acted on it. Those people that get to put their tuppence worth in, people who draw on social care, were excluded from those debates, and we jumped to function. And the function that we jumped to, I think the reason that people kind of on the left generally jump to that function, I think, is for some of the reasons that Jon was alluding to. It's a slogan rather than a really kind of detailed description. People love the NHS, and they love the idea that it looks after our health, and they don't know much about social care, so they think something like that would, because it's great to keep us healthy and alive. It will be great to help people to have good lives. And people in our movement are terrified at that idea of any bureaucratic monolith. Sorry, just one last point about coming to Patrick's point about local government, whether local government's the best place to locate this activity. People often misquote Churchill, don't they? That thing where he said that democracy is the worst kind of government apart from all the others. I think I'm kind of tempted towards that idea. Local government is itself bureaucratic, and it itself doesn't bring community in to share power effectively enough. But it certainly does it better than the NHS. And there are probably ways in which we could adjust things at that level to make them move in the direction we want them to, I think.
Thanks, Martin. I think one of the important kind of context for this discussion is that England's been quite stuck in terms of social care reform for a long time, whereas certainly Scotland and Wales have been pursuing reforms and have kind of gone further, and so there is some kind of learning from there. So in England, we had a Care Act in 2014, which included lots of good things, but hasn't been implemented. And we have only much more recently, with the passage of a new act last week, agreed some social care reforms. So kind of changes happening, but a lot of the changes focused around who pays for care and how much private individuals will pay. So proposals for a cap on private spending on care. So this is for people who don't meet the means test threshold, whose assets are too high. There will be kind of limits on how much people will pay individually. I mean, Patrick, I was going to bring you back on that kind of question of learning from Scotland, given the sense that they've done more and they have been more active, and what can England learn? In Scotland, we have people who have free personal care already, so personal care isn't means tested, so that's support for getting up and getting dressed, and access to food and those sorts of quite narrow kind of personal care tasks. But I know in our research on the Four Nations, we found that the sort of focus and investment on that was kind of taking away from some of the kind of living a life aspects of care that I think Anna was really talking about. So Patrick, can I kind of bring you in on kind of some of that learning from Scotland?
Yeah, sure. I mean, in our research, you know, again, free personal care becomes this kind of big idea about moving closer to a model based on the NHS, where people are able to access services in a consistent way, which are free at the point of use. I think in reality, what's happening in Scotland is a very mixed picture around free personal care. There's a process of rationing which happens as a result of personal care becoming free, and personal care becomes defined in quite a narrow way in terms of functional task, in terms of getting people out of bed, particular help with tasks of everyday living, rather than that kind of holistic, personalized, preventative vision of care, which Martin and others have put forward. So I think there are real trade-offs here, and we have to be really honest about that. Within a set of limited resources, where a system is asked to do something without additional resources, then some form of rationing always occurs, and that's definitely happening in Scotland. You've got more people that are waiting for services, and you've also got more people, maybe more people who are receiving personal care services free at the point of use, but maybe that is at the expense of a focus on helping people to live lives in communities, and perhaps at the expense of the welfare of people working in social care as well, by narrowly defining their jobs as a set of tasks or time. So I think that it gives us a bit of a kind of foreshadows the idea of a national care service and some of the problems that it might face, or indeed if we were to introduce something like that in England.
Thanks, Patrick. And I know one of the key strains around social care has been a lack of adequate funding, and certainly any kind of funding on parity with the NHS. Martin, I know you've spoken about the fact that we shouldn't get too hung up on the money, because there's a danger that we just sort of put money into shoring up a failing system. So do we need more than just more money?
We definitely need more money. Very significant amounts of money have been taken out of social care over the past decade or so. There's no doubt at all that we need more money. Then the question is what that money gets spent on. When people say money is the only issue, I kind of point to my age really, and the amount of time I've been around in social care, because I can remember the times, well before austerity, and we weren't really shifting things in a new direction then. It's kind as if, time has stood still, and the core models of support to people that we developed in the kind of mid to late 20th century have become fixed. And the debates about the future of social care are hardly about a vision of new social care. That we talk about prevention and so on, but the mainstream debates are about how to fund, organise and staff the existing ways of doing things. The good news, I think we need a bit of good news in this discussion, don't we, is that there are glimpses of a better future all over the place, all around the country. There are things that places and people and organisations and groups are doing that start to paint the picture for us of how this could be, where we're not only dependent on the resources that come down specific public service channels, and that where people are using public service resources differently alongside community resources and people's own capacities and connections and so on. There are examples of approaches and organisations and groups, and even the beginnings of places doing things quite differently. So let's not despair about this. We absolutely do need some money. Our arguments have been that there will need to be an injection to help us to kind of move upstream, to start to help people to avoid the need for significant, in some cases, long-term support, because we can create better options for many of us for quite a long time. We've never had that. We've always talked about prevention and the need to do that, and we've never had any kind of significant resource there. We made a proposal for about a £500 million change fund in the current reform process. Well, £30 million has appeared in the white paper. I guess that's not nothing, is it? And there are funds for changing other things like housing, for example, as well. So let's use opportunities. Let's use the interests and enthusiasms and examples that are around the country. And it's great to see the Impact Centre starting to get going, because I think that centre can play a really useful part in this.
Thanks. A great segue there, as I was about to ask Jon about kind of how is the Impact Centre, what's it doing, and how's it helping kind of embed some of these good news stories?
Yeah, and I agree entirely with Martin, but Impact is a new UK centre for implementing evidence in adult social care. And when we talk about evidence, I'm referring to different kinds of research, but also the lived experience of people who draw on care and support and carers, and the practice knowledge of frontline social care staff. So we're seeing evidence of what works as involving research, lived experience and practice knowledge. And those to me are all three slightly different ways of knowing the world that are really important to bring together, to triangulate and to work with as you bring people together from different backgrounds to work on common challenges and common solutions. And we've been very fortunate to receive £15 million over 7 years from a government and a charitable funder to start this centre, really trying to work with different areas of the country to run a series of different pilot projects to get evidence of what works used in practice to make a difference to services. and hence to people's lives. Very similar to Social Care Future, our belief is that good care isn't about services, it's about having a life. And we think that evidence of what works and what can make a difference from research, but from exactly the kind of good practice examples that Martin mentions as well, are part of how we try and move local systems and the system as a whole towards that vision of a better life for all of us. So we're just getting up and running as a national centre. Colleagues are very welcome to go to the website and sign up for regular updates and so on. There's a series of different jobs around different parts of the country with some of our pilot projects. But effectively, this is a long-term investment in trying to draw on evidence as broadly defined to try and make a difference to services and people's lives. And as Dan, I think, just said in the chat, there are a couple of recent podcasts out from different members of the impact team, people who draw on care and support, carers, frontline members of staff in different parts of the UK, if people are interested in exploring that in more detail. What we found, though, Catherine, with that is that we've described it as there's never been a worse time to set up a centre like Impact, but there's also never been a better time. You know, clearly we're doing it when everyone's under so much service and financial and workforce pressure, and during a pandemic, never been a worse time to try and do something like that. Equally, everyone's talking about care. 80 odd people have turned out tonight after hours to listen to this debate. Some of the groups that Martin's talking about have been working around the country to try and make a difference. You know, everyone's saying that care needs to be different and needs to be better in future for all of us, for the kind of society that we want to have and the kind of communities that we want to live in. So everyone in the sector has been telling us, in one sense, John, there's never been a worse time to try and set up a centre like this, but equally, there's never been a better time. And I think those two statements can be true at the same time, bizarrely.
Thanks, John. So there's lots of kind of great comments being made in the chat and the Q&A. So I'm going to start to sort of feed some of those through. Question from David about where we might, in Europe, we might look to for a successful model of a national care service and what can we learn from this? So Patrick, I know it's often been, Germany and Japan have been talked about as places which have reformed their care services recently. Are those the sort of directions we should be looking at to learn lessons for England?
That's a good question. I mean, those are the types of systems which, don't mirror the NHS. They do have a large degree of, of local discretion, a big role for local government, and are funded in a fundamentally different way. They're funded through national insurance schemes, which, we've seen some of that thinking influence the debate in the UK, and I think that's a good thing. Because I think actually, the political sustainability of a funding settlement is really important, and the sense that people can feel that they are getting out what they're putting into a pot, I think is a really important part of building a sustainable funding mechanism. And I think actually that's really missing from a lot of the proposals. So it'd be interesting to see how in this really difficult financial environment that we're going into with the cost of living crisis, whether the government's proposals around increasing national insurance are maintained, and whether that funding that Martin talked about is actually ends up in improving services and improving lives for older and disabled people in local government. So yeah, in answer to your question, I think that interest in those types of systems is a much more fruitful direction for debates around reforming adult social care in England, because I really don't think that a national care service is a good goal for care reform, because the things that help us have good lives lay outside of services. They lay outside of formal services. They're about the quality of our family and community and working lives, So I'd like to see, you know, how we can build a social care system which focuses on the development of those things.
Thanks, Patrick. Clearly change is going to take quite a lot of political will, and we know that it's been a very difficult political issue for senior leaders. So we had, back in 2010, we had the death tax allegations thrown at Gordon Brown's proposals for bringing more money into the system. We had the dementia tax thrown at Theresa May around some of her proposals of reforming care funding. We seem now to be edging a bit further with the health and care levy, although most of that money is going to health. And as Patrick says, the kind of the other squeezes on people's finances may make that politically difficult. So Martin, I mean, you've worked at Department of Health and Social Care. Is your feeling that the kind of political will and courage to really make a proper change to social care, is that going to happen?
It's hard to see that happening in any kind of big bang way in the short term. I mean, one way you might think about this is that we have seen some political will recently. You know, in my experience, the only time that the Treasury lets significant money go for social care is when it's under very significant political pressure from the Prime Minister, really. And that's just happened. Sadly, from our point of view, that political capital was used to get money, hopefully, for something that won't make any difference to social care at all. It will mean that some people won't have to sell their houses, and some of us will get inheritance that we might not have gotten as much of before, but it won't make any more social care or any different social care happen. There's very little, even if the money, as Patrick says, does get released from the levy. Feels a bit like the levy is dry, sorry. But even if that does happen, very small amounts of it are for change. But what we have to do is try and go again. But, you know, because the Prime Minister did what he said he was going to do. That was what was in the current government's manifesto. So we need something better in another government's manifesto as soon as possible. And we need another Prime Minister to be persuaded to put that kind of pressure on whoever's the Chancellor in the next government. But I think for us, you know, we think about this as in a kind of politics 101 way. Politicians prioritize what the people that vote for them prioritize, and people currently do not prioritize social care. Sometimes we persuade ourselves that there's a poll that comes out that looks like maybe some people are prioritizing, but those tend to be polls when people are given a choice of things that they might want to see funded. And if social care goes on a list like that, sometimes people tick it. If you give people an open choice, they don't pick social care. And we think that unless we change that basic political reality, it's going to be very difficult for us to generate significant political will, and which is why we think what's really important is we do much more public-facing work. We did some work with Survation last year, which very much encouraged us, really, because we put our vision in front of the public, and the idea that the social care that public have is conditioned by what the sector says and how that's amplified by the media. It's about silver tsunamis and threats to the NHS and burdens on the system and so on. That's what the public hear, and they really are worried about, they don't want anything to do with social care, and they don't want any of their families to have anything to do with it. So until people start thinking about social care as being something that's important to them and their family and their friends and the communities, and it's something that you want, not something that you want to avoid, it's going to be very difficult to shift that political situation, which is why, you know, we're just about to try and get a process going, because in other countries they have done that. You know, every Australian counts did that, and whatever you feel about how that's playing out in practice in some detail, it massively increased the amount of money that's gone into support for disabled people. And in the US, they have Caring Across Generations, which seems to have significantly influenced the president's pitch for what he's now calling billions of pounds for infrastructure funding. Hope he gets it. Unless we change that politics, we're dependent on playing a really weak hand and all the ducks being in a row. You know, we need, you know, I worry, sorry, I'm going on too long, but just one last thing I would say. I have to get this in. One of the things I often feel is that the market doesn't care about you, and the state believes wrongly that it knows what's best for you. And people are somewhere in the middle of that. So we've got to work on the political parties and the underpinning political forces to get left and right, you know, shifting from those unhelpful ideological positions. I think either the market's what makes everything work well, or the state, you know, in a national care service or whatever, is going to be the solution.
Thanks, Martin.
Sorry, that was a very long answer to probably a different question.
There's been a few of the comments in the chat have been about integrated care systems. So these are fairly well developed in Scotland, and certainly in Wales further developed than here. Jon, I know you've done some work around integrated care. Is there a feeling that if we're all going to have integrated care systems, maybe that sort of solves the problem and we don't need to do much about kind of social care in its own right?
No, I think integrated care systems in England look like a bit of a mess, with really kind of confusing accountabilities and structures, and it's really hard to see how they might work or make much of a difference in practice. They're an attempt to stitch back together part of the NHS system that was so fragmented with the reforms that took place in 2012, effectively trying to recreate a bit of a sort of regional tier that was lost in that reorganisation. But the accountabilities are really unclear, and a danger that they focus very much on internal NHS priorities and not on joint working with local government or on the importance of local place. And everything we've learned about integration is that people's lives are more complicated than the structures that we create in our welfare services. So we need to find ways of joining different things up where people have multiple needs or complex needs or fluctuating needs. But we need to join it up around the realities of people's lives, not according to our kind of professional and our service boundaries. And we've also learned that it works best when we talk about the outcomes that we're trying to achieve as a society, and then think about, well, who do we need to involve and what kind of relationships do we need with each other in order to bring those outcomes about, rather than what we tend to do is start with a kind of structural solution, and then we get stuck into the structures and the reorganisation. And all the evidence there suggests that structural reorganisation can make things worse rather than better in the short to medium term. And in the NHS, of course, we structurally reorganise so often that the system just about gets back to where it was before we then start to reorganise again. One of my colleagues slightly harshly described the NHS as an organisational shantytown, where we hastily cobble together some of our structures and nobody bothers to do it too carefully because they know that in 6 months the bulldozers will come and displace us somewhere else. And I have to say, with integrated care systems, I can see a degree of history repeating itself. Now, in areas with joined up systems and mature relationships and strong leaders that are really community orientated, we can work within those structures to enable and support good things to happen bottom up. But I think the danger is that some of this could be a massive distraction from some of the changes that Anna was talking about at the start. And then as we try and recover post-COVID as well, we could end up in a situation where we're trying to deal with an awful lot of kind of need that's built up without a lot of clarity about kind of accountability or responsibilities. So so I'm a little bit nervous that it can't, a bit like Martin was saying actually about what's happened in Scotland. The danger is when you get some of these concepts, they become a kind of solution in search of a problem. So anything you identify now, well, the solution is it's a national care service in Scotland, or it's an integrated care system in England, and without being clear what it is we're trying to achieve together by working together.
Thanks, Jon. And I think there was a comment made early on in the chat of, you know, some of the aspirations that Anna was talking about really early on for social care, about it being person-centred and helping sort of support people to lead good lives. Those are also aspirations for the NHS. And so I guess, you know, we need to kind of accept, you know, that as well, and around the development of integrated care systems, it isn't about sort of saying that that's not important in health either, because of course it is. In terms of some of the services that kind of sits kind of closely within or sort of adjacent to social care. It's not just health. I mean, housing is clearly an important service, and kind of housing with care, I think is something that we need to think more about. I mean, Patrick, is that something that you've any thoughts on around how we kind of bring housing into this conversation?
Well, it's interesting actually that housing wasn't part of the proposal by the Scottish Government around the consultation that they put out. So the proposals for a national care service radically kind of increased the scope of what was proposed by the Feely report, which Martin referenced. To include children and young people services, community justice services, alcohol and drug services, social work, prisons. There was a huge kind of expansion, which I think was kind of driven by kind of political expediency on part of the Scottish Government. So I think there is of course all of these different services, including housing, housing and care, extra care housing, kind of supported housing services are all kind of an integral part of a social care system. I do worry that actually the less the focus is on kind of informal networks of support and more on the kind of formal divisions of services which kind of come out of local and central government, we lose focus on what the goal is here. Again, it comes back to this question about form and function. What is it we want? And again, there's the huge unaddressed issue of how we build a society in which unpaid care and family care is made more straightforward, more sustainable, better valued, because that makes up the vast majority of care. We're always talking about care, but actually the kind of informal structures of care, which is largely delivered through families, is really becoming much more difficult because of kind of structural social changes that are happening. But in the proposals, all there is this kind of this idea that people will have a right to a short break every now and again, and for me that kind of really falls short of the kind of change that we need. And Martin talked about the state doesn't, the market doesn't care about you and the state doesn't know you. Who does care about you and who does know you? I think the answer for a lot of people is your family and your community. So how do we facilitate care by those people? That would be the question that I would ask.
Thanks, Patrick. We're getting towards the end now. I just wanted to ask a final question to Martin. There's been quite a few of the questions and the comments in the chat have been about the sort of tactics of change. Do we need to stop talking about crisis? How do we change the narrative? I think I'm right in saying that Social Care Futures has just got some money to start. Well, I know you've already started thinking, but to sort of take forward some of your work around that. So do you want to just kind of briefly mention that in the last couple of minutes?
Yeah, I wouldn't exaggerate the money, but yes, very kindly, a foundation has given us some money to go from general thinking about this to more specific thinking, because our feeling is that there's much to be done, and we want to be part of doing it, which is helping systems and professionals and people in all sorts of different ways to take those glimpses of the future and do something with them. And so let's not be totally central government dependent here. We've got a lot of agency ourselves in our places and our organizations, but we do think that Politics 101, unless we have a different kind of engagement with the public that leads to much greater possibility of political prioritization for both resources and different approaches to social care, it's going to be difficult for us to make big paradigm type shifts. And even though some of us are a bit long in the tooth now, we've decided that we need something that is a bit like a fairly long-term campaign to do that. It's difficult to conceptualize. It's difficult to consider who might play what role to make this happen. But we've decided we're going to give that a go, and we're really keen. We bring in some smart people in who've been involved in significant, successful international movements for change. So we're going to bring those people in. We're going to bring people together that want to make this happen. And over the next 6 months or so, we're going to come up with some propositions, and then we're going to try and get people to give us millions of pounds to do that over the next few years. So basically, in a nutshell, if anybody's interested in this, just go to our website and you'll find out what we're doing. And if anybody's got any money to spare, do send it our way.
Thanks, Martin. I'm sure if they Google social care features, you guys will come up. And I know you're very active on Twitter as well, aren't you? So we're out of time. So thank you to all our attendees for coming along to today's Bringing Birmingham to You event. Thanks to our speakers, so to Anna, Martin, Jon and Patrick for their contribution. As we continue with this series online, we're really keen to hear from you about the kind of areas of research across the university, given the breadth of areas we research. So let us know which kind of areas you're interested in, and you can share those with the colleagues in the alumni team. And we'd really welcome your feedback on this event. So there will be a short feedback survey that will just be put up in the chat now. But thanks all. It's a sunny evening here in Birmingham, so you're probably all over the world, aren't you, without necessarily going into a sunny evening. But anyway, enjoy the rest of your evening, and we look forward to seeing you at an event very soon.